Once more, very good morning to you all, my dear students, and I welcome you all into the industrial pharmacy first. So, dear student, we are on to the ophthalmic. So, as I said that we are on to the ophthalmic preparations, and these are the kinds of preparations which are to be instilled into the eyes or applied onto the eyes in order to correct the various kinds of the disorders, like say the infections and all, right? Okay, so if you see the ophthalmic preparations, there are a number of preparations like say the eye drops, eye ointments, ocular inserts, right? And already we have started the details associated with the ophthalmic preparations. And today we will go through the preparation of some of the ocular drug delivery system, that is ODDS, ocular drug delivery system. Then we will see some of the containers that are used for the ocular drug delivery system. And the last but not the least, that is the packaging of ocular drug delivery system. So these are the points that we have to cover. We have to try to cover in our today's talk. And in order to cover this, we will go through the manufacturing and the packaging of the ophthalmic preparations, right? So as far as if we see the process of preparation of the one of the most common type of ophthalmic product, that is the eye drop, isn't it? That is the liquid preparation or the liquid dosage form. So how to go for preparation of this eye drop? So the preparation of eye drop, that will involve the 4 different steps. In that, the very first step that consists of the preparation of solution, right? So as it is the eye drop, as it is the liquid kind of solution, so that require the addition or say dissolving constituent which is said to be the active medicament or the active pharmaceutical ingredient or the drug that is needed to be added into the vehicle. That vehicle might be aqueous, non-aqueous, so whatever may be the requirement. Based on the requirement, one has to go for selection of these uh, aqueous or non-aqueous vehicles. Okay, so the first stage, that is the formation of the solution. For the eye drop, it is the kind of a solution. That means it is the clear liquid, right? So once we are producing this solution, then the second step that involves the process which is said to be the clarification. So clarification, that is nothing but the removal of any kind of particulate matter. So that is the clarification. The third stage followed by the clarification, that is the filling. Filling, that is nothing but the addition of a particular solution into the container system, right? So once we had added this into the container, then we have to go for the sterilization. So there is a terminal sterilization, right? What is the terminal sterilization? That is the process of sterilizing at the end, after the process of preparation and addition into its container, right? So all these are the 4 different steps by which we have to prepare the eye drops, right? Then in order to prepare this solution, this is the very first step. What we require the various kinds of ingredients, we require the various kinds of excipients. So what are the different excipients or the ingredient that we want in order to prepare the ophthalmic eye drop? dosage form. So we require the antioxidants, we require the stabilizers, we require the tonicity modifiers, we require the viscosity enhancers, and we require the buffers. See, all these they will be having their particular purpose. Buffer, that is in order to maintain the pH, viscosity enhancer in order to increase the viscosity so that there should be a prolonged contact time between the product and the uh, biological system, antioxidant in order to prevent the process of oxidation, stabilizer in order to maintain the product stability over a period of shelf life, and tonicity modifier, that is in order to match the concentration of the ions, right? It should be isotonic, as already we saw that it should not be hyper or it should not be hypotonic. Instead of that, what we want it as a isotonic. Okay, so once we are adding all these ingredient, then we need to add the API. Then API is added. API, active pharmaceutical ingredient. Okay. And the vehicle that should be made up with the volume. So the volume has to be made up with the help of addition of the vehicle, the required volume. So this is the way by which we have to go for preparation of the eye drops, right? So the second stage, as I said, that first is the preparation of the solution. Second, that is the clarification. So in order to make the product or in order to make the eye drops clear, there is a need to go for making the product free from that of the particulate matter and the bacterial endotoxin. For the ophthalmics, there is a stringent requirement, same as like that of the parenteral sterile dosage form. It should be free from that of the particulate matter. It should be free from that of the bacterial endotoxins. So in order to make them free from that of the particulate matter and the bacterial endotoxins, the filtration process that is to be adopted. So there is a need to go for passing the solution through the sintered glass filter or sometime the membrane filter of the micrometer pore size that to be used. So the clear solution that is filled directly into the final container, which are sealed prior to heat sterilization. So before the process of sterilization, they should be filled and they should be sealed. So they should be filled into a suitable container to filtration sterilization. So the sterilization that will involve the different methods like say the heat sterilization and the filtration sterilization. So depending on the properties of the ingredient, one has to go for selection of either filtration or the heat sterilization method. Then it is to be uh, this is to be used, which is filled into the final container and then sealed prior to the sterilization. So as I said that in case of sterilization, if it is the heat sterilization, what we have to use, that is the autoclave, right? So at 115 degrees Celsius for 30 minutes, that is the duration of exposure. Or if we want to reduce the exposure time, we need to increase the temperature. So either we can go for sterilizing at a temperature of 115 degrees Celsius for 30 minutes or 121 degrees Celsius for 15 minutes. Either of these two can be used in order to sterilize the ophthalmic eye drop product. Then heating at 115 degrees Celsius for 30 minutes together, either we need to add the benzalkonium chloride or phenyl mercuric acetate or nitrate or thiomersal. If we want to adopt the method of filtration, that is the filtration through a membrane filter, where we are going to be using the bacteria proof filters onto which the bacteria these are captured by the filters, they will retain onto the filter, which will allow to pass the water through the filter paper. So filtration through a membrane filter that having 0.22 micrometer pore size into sterile container using strict aseptic techniques. So that is the most important requirement. Aseptic environment we want, free from that of the microorganisms. Then in case of the dry heat sterilization, we need to heat it at 160 degrees Celsius for 2 hours, and that is to be employed for the non-aqueous preparations, like say the silicone rubber test that must be used. Then immediately followed or following sterilization, the eye containers that must be covered with a radially breakable seal to distinguish between the opened and unopened container. See, this is most important because say once the process of sterilization is over, in order to distinguish or in order to identify which container is opened and which container is unopened, so in order to maintain the sterility of the product, this sealing that is required, and that seal would be of a radially breakable type seal. So ophthalmic preparations, like say the suspension. Again, this is the another kind of dosage form which is there in case of the ophthalmic. The first of its kind which we saw, that is the eye drop, followed by there is a eye suspension, isn't it? Whenever it is the suspension, that means what? It will contain the solid particulate matter. These are suspended into the vehicle, right? So ophthalmic suspensions, these are used for some specific purposes, right? So what are these purposes? What are these reasons? So the reasons for which the ophthalmic suspension is used, that is to increase the corneal contact time of drug substance. See, in order to increase the duration of action, in order to increase the contact time, so that the drug that can be released localized for a longer period of time, there is a need to go for development of this suspension kind of formulation. The suspension that will provide more sustained action, so the action that is for a longer period of time, it is slowly releasing the drug. It included those solid preparations that when reconstituted according to the level instructions. So suspension, that is reconstitution type also. Whenever it is required at that time, it has to be prepared. Then it required when the active ingredient is insoluble or is unstable into the solution. So this is the basic reason for which why one has to go with the suspension kinds of formulations, isn't it? Because one when cannot go for preparation of this solution, or when the drug has its intrinsic properties, pre-formulation properties, like say the solubility, right? When the drug that is insoluble, so we cannot go with the preparation of the solution. So the option remaining, that is the suspension type. And suppose if solution is prepared, but that solution that is going to remaining unstable, or if it is going to be hydrolyzed, then in such a cases it is very very difficult to go with the preparation of the solution. So that's why there is a need to go with the suspension. So all these are the reasons that why particularly the suspensions, ophthalmic suspensions, these are going to be prepared. Okay, let's move next. Okay, commonly formulated, these suspensions can be commonly formulated by dispersing micronized drug particles or the drug powders, right? You can see there is an example of the prednisolone acetate ophthalmic suspension, USP. This is officially in USP, that is the 1% suspension, and this will contain the micronized drug powder with the diameter of particulate matter less than that of the 10 micrometer in its size. Next, in powdered form, the drug may have much longer shelf life than in solution or suspension, isn't it? So whenever we want to go with the long stability, or say the stability for a longer period of time, in that case, at that time, there is a need to go with the preparation of this particular kind of suspension, which are to be reconstituted before its use, right? So they should not be provided into the solution or suspension, but they should be provided in the form of the powder. So what is the disadvantage associated with the suspension? Although they will have certain advantages, there is a disadvantage, that is the concentration of Dissolved drug cannot be manipulated due to their relative insolubility, right? So this is the disadvantage associated with the suspension kinds of the dosage form. Okay, after going through the eye drops and the eye suspensions, or the ophthalmic eye drops and the ophthalmic suspensions, there is another formulation, another dosage form, which is said to be the gels, ophthalmic gels, right? So the ophthalmic gel, these are permitting, or these are for the localized delivery of the active pharmaceutical ingredients, and they will contain the mucoadhesive polymers. So they will extend the contact time of drug with the biological tissues, and thus these are responsible for improving the ocular bioavailability. See, if we just see eye drop, suspensions, gels, as we will move from eye drop suspension to the gels, we can see that there is a prolonged contact time, and as there is a prolonged contact time, there is a for a more period of time the drug that will remaining in contact with that of the biological tissue. So there is a increased absorption of the drug, so that will leads to that of the increased or the improved bioavailability. What is the bioavailability? Yes, the rate and amount of drug that will appears into the systemic circulation, that is said to be the bioavailability. Okay. Then there is another formulation which is said that the eye lotions, right? So the eye lotions used to assist in the cleaning of the external surface of the eye. So these are for cleaning purpose. Most of the time, in case of when the person that is using the ocular inserts, or say the contact lenses, in that time, at that time, in order to clean these contact lenses and the eyes, these eye lotions are going to be used. So they will remove the non-impacted foreign body or clean away the conjunctival discharge. For surgical use, in surgical or first aid procedure should not contain the antimicrobial preservative and should be in single use container, because these are the single use container, so there is no chance of contamination, and it should be sterile, so it should not contain the antimicrobial ingredient. Preparation is very simple and most common consists of the normal saline. What are the eye lotions? Eye lotions are generally the normal salines. There is a example of the eye lotion, like say the Optrex. So the Optrex that is used in order to clean the eyes. Then requirements of the eye lotions: it should be sterile, containing no preservative, sterile, free from that of the microorganism. Preservative should not be added because it is for the single use. It should be isotonic with the lacrimal fluid. The ion concentration that should match with that of the lacrimal fluid. It should be neutral at its pH so that there should not be any kind of the irritation. The large volume but not greater than 200 ml. Eye lotions that can be provided maximum up to 200 ml. Then it should be non-irritant to the ocular tissues. So all these are the ideal requirements in case of the eye lotions. In case of ophthalmic products, there is a need to have some of the labeling instructions. So the labels that should include the title identifying the product and the concentration of the content. Let us say, for example, the gentamicin sulfate ophthalmic ointment, USP 0.3%. That means this is very, very official in case of the United States of Pharmacopoeia. The strength of gentamicin sulfate, that is 0.3%. So the gentamicin sulfate, that is the label, and 0.3%, that is the concentration. Then some of the special instructions that need to be printed onto the label for the ophthalmic product, like say sterile until it's open, not to be taken, use once, and discard the remaining solution, and the expiry date. So all these are the very, very common ideal labeling instructions that are required in case of the ophthalmic products. Also, we can go for adding the keep out of reach of children or discard remaining solutions not more than 4 weeks after first opening. So this is most important in case of eye products. Eye products generally that should not be used more than 4 weeks. Once it is to be opened, that should be used and then it should be discarded. So generally there is a habit, there is a practice that whatever the kind of product we are bringing, we are using for the particular kind of disorder. If the same kind of disorder that will happen in future, we used to go with the same, but that should not be carried out. As a pharmacist, we should know all these things and we should educate to the others also. Lotions should be supplied in colored fluted bottles and that should be sealed one. Then the formulations of the eye ointment. So we had gone through the eye drop, we had gone through the eye lotions, we had gone through the eye suspensions, we had gone through the eye gels. Now in the line of same, there is a eye ointment, isn't it? So what are the advantages associated with the development of these eye ointment? They will provide the greater total drug bioavailability, right? So again I told you that as we will move from solution, suspension, lotion, gel to the eye ointment, as we will move, the consistency that is getting increased, the viscosity that is getting increased, so which definitely will offers the more prolonged contact time, which directly helps in case of more absorption and more bioavailability, but they take a longer time to reach peak absorption. Because they will contain the base, and from this base there is a need to come out of drug and to appear into the systemic circulation. That's why it will require some time in order to show its action. So although the ointment they will be having these advantages, but that is they are associated with the disadvantages. Like say the disadvantage is that they will temporarily interfere with the vision, because there is a blood vision, because there is a base, so it will interfere with the vision, right? So that is the disadvantage associated with this ophthalmic preparation. So the ophthalmic preparation, they should be sterile. Again, how we can make it? Yes, by the usual method. Then it should contain the antimicrobial preservative, antioxidants, and the stabilizers. These eye ointment, they will contain the preservative because these are for the multiple use. And in order to avoid the process of contamination during its use, the preservative that need to be added, they must be free from that of the particulate matter, and the particle size that can be reduced less than that of the 25 micrometer. So as far as the preparation, as far as the formulation is concerned, basically they will contain the different components. So the first component, that is the liquid paraffin, that is the 1 part, wool fat, that is 1 part, yellow soft paraffin, that is 8 part, and hard paraffin as required to produce the required consistency in hot climates. See, in the countries like say India, where there are extreme conditions. In case of winter season, there is a extreme cold temperature. In case of the summer, there is a extreme heat, right? In case of monsoon season, there is a intermediate temperature, humidity, and the cold environment. So what I mean to say is that the product that should remain stable over this wider range of climatic conditions. So for that purpose, there is a need to add this particular ingredient into the different concentration. Let's say, for example, the hard paraffin, because of its nature, hard paraffin nature, so that will not allow the product to get